Have your teeth ever felt sensitive when you eat something sweet? How about something hot or cold? A common question that dentists get from their patients is how to stop their teeth from being sensitive. Tooth sensitivity is commonly overlooked. Many people just assume there's nothing they can do, so they just deal with it and move on with their lives. But what if we said that most of the time, tooth sensitivity can be prevented or easily fixed? Well, first, you should probably know what causes your teeth to be sensitive in the first place. A common reason your teeth get sensitive is because your enamel, which is the outer layer of your teeth, gets worn away and exposes the dentin underneath. Your dentin is made up of tiny tubules. These tubules have nerve endings inside of them. So when they get exposed, it's gonna hurt. But how does your dentin get exposed in the first place? Well, there's many ways this can happen. One of the most common ways is brushing too hard. You don't need to brush very hard. In fact, you can actually clean your teeth better if you brush softer. The harder you brush your teeth, the more you risk scraping away your enamel and causing sensitivity. And wearing away your teeth isn't the only thing you risk with brushing too hard. You can also damage your gums and expose the root of your tooth. But the end result is the same. Your teeth are going to be sensitive. Another common way your teeth get sensitive is from acidic foods. You can't always avoid acidic foods, and having a soda every now and then isn't really a big deal. But if you start every morning by sucking on a lemon, chances are you're going to have some sensitivity. This is because acidic foods can erode your teeth and expose the dentin underneath. If you absolutely have to have acidic foods, one thing you can do is swish some water in your mouth after to help neutralize some of those acids. Want to know what else can cause sensitivity? You might have heard about people grinding or clenching their teeth when they sleep. Or you might do it yourself and not even realize it. Over time, this can cause your tooth to wear down and even fracture. Ouch! If you ever wake up with jaw pain or a headache, this could be a sign you grind your teeth. Or you could also ask your dentist if there's any signs that you grind your teeth. A common assumption people have is that if they have tooth pain, they automatically have a cavity. Well, we already showed there can be many other things that cause tooth pain. A cavity normally forms gradually because of tooth decay, but it could still hurt if it gets big enough. Luckily, if you've been keeping up with your dental visits, your dentist should be able to tell if you have a cavity forming and can fix it before it becomes too painful. People can also get sensitivity if they just had their teeth whitened, but this normally goes away after a while. And if you just had a filling, you might feel sensitive in that area for a few weeks. So as you can see, tooth sensitivity can happen to almost anyone. And if you have sensitivity, it's important to visit your dentist because it can be hard to point out exactly what's causing it. If something's really minor, a common solution is a sensitivity toothpaste. Remember how we said your dentin is made up of tiny tubules? Well, these toothpastes can actually plug up those exposed tubes and prevent your teeth from hurting. One thing you should keep in mind, it's better to act sooner rather than later, especially if something's causing you pain. Ignoring a problem only gives it time to get worse and cause more problems later on. Thank you for watching. If you liked the video, please hit the thumbs up button and subscribe to our channel so you don't miss our new dental secrets every week.